I made a proposal to my professor at the time, Professor Bob Morris. Now I was cheating, right? I was trying to stay in the group a little longer, trying to find a more permanent job. So I said, listen, what if we make these compounds? We'll have these NH moieties. If you put such a molecule under hydrogen gas with a base, you're going to remove the chloride, replace it with hydrides. Now you could have these intramolecular hydrogen bonds. Maybe they can be used for catalysis, and by now you realize I'm really getting carried away. Professor Morris wouldn't buy it. He said, listen, well, if you know better, you know that compounds like this don't exist. The mechanism is not possible because, you teach the catalysis course. You know better. A ligand need to dissociate for the substrate to coordinate. And, it would be a waste of time and money. So with his permission, I said, okay, you know what, since you won't buy the ligands, well, maybe I'll try and make them and we could test them. So we got some amino acids. He had some amino acids in the lab, and this is a process. So we converted to the amino alcohol, then the chloride, and make these aminophosphines. So these were the first set of amino acids we make, and they were made from, the aminophosphines they were made from amino acids. And then we bind them to the metal, we make these catalysts. So we were able to demonstrate very quickly that these work. They're very good catalysts. They can hydrogenate ketones, amines, aldehydes, and you get the respective alcohols and amines. So a couple of years later, by 2000, we were now being in discussion with Firmenich. So Firmenich is one of Firmenich right now is the second largest fragrance and flavor company in the world. They produce a variety of fragrances. Some of these fragrances are sandalwood fragrance. So for example, this compound, Dartanol, they produce it in 500 ton per year scale. The standard process they use is sodium borohydride. So to make 500 tons, they need 100 tons of sodium borohydride. Now when the reaction is finished, they quench it with water, then quench it with acid, and they extract it, distill it, and get their product, but they also have 500 tons of boric acid waste to dispose of. So this is a process that they now use, actually using that simple, the first catalyst I made. And now they only need 50 kilograms of catalyst. They're looking at a substrate to catalyst ratio of 200,000 to 1. More efficient manufacturing, just a standard hydrogenation. The solvent is 2-propanol. It can be recovered and recycled. The patent was filed in September 2000, and by May 2001, it was industrialized on a 500 ton per year scale. And this process is actually still in effect today, plus several other synthetic sandalwood fragrances and other fragrances, some of which I'll mention very quickly. Now, we used to call this catalyst Kamal's catalyst, but Firmenich prefer to call it the bomb. So this is another project that some of which was done with Firmenich. They produce this fragrance. It's stearyl acetate. So essentially, it's acetophenone. You get phenylethanol, and then you convert that to the acetate. It's an industrial fragrance. It's actually used in soaps, in cleaning products, floor cleaners and strippers and so on. And it's produced in the tens of thousands of ton per year scale. Now, the original process to make this is using heterogeneous catalyst, so you could use nickel, powdered nickel, and palladium. The problem with the heterogeneous catalyst, you also get some ethyl benzene product. And if anybody here has ever smelled ethyl benzene, you'll know that this is not a very good process to be making any fragrance material. Now, the problem is that they now have to distill the product several times to remove the ethyl benzene. The process we develop, we're just using our catalyst. In this case, we use a neat substrate, no solvent. So go from neat substrate to neat product. No distillation is required. You just throw in your acetate, your copper catalyst, and you get your fragrance. We actually scale this up to a substrate to catalyst ratio of 1 million to 1. All right, so a very successful demonstration and industrialization of this technology. Now, Firmenich is also, they produce a range of fragrances, and quite a bit of these fragrances have their own brand name. Like, for example, there's this grapefruit fragrance which they call Pamperwood. They make it on a 1 ton per year scale. It's a fine fragrance. It's very expensive, and the standard way they used to make it involve some borane reagent. Now, those have to be stoichiometric borane reagent, some of which had to be chiral in order to get some selectivity. Now, using this catalyst, we were able to make it. And so what is key here, and what I really want to point out, is that it's a ketone hydrogenation that's required, but within that ketone, you also have this apical double bond. This is very sensitive, all right? With the borane reagent, they also get some reactions with this double bond. With our catalyst, it selectively reduces the ketone, leave this double bond intact. In addition to just simply, doing the reduction, they also need to get a ratio of what the exo and endo ratio of 60 to 40. Firmenich said, listen, that's necessary because it imparts a certain radiance to the fragrance. I have no idea what they're talking about, but it works. And so this process has been scaled up. They actually use neat substrate, no solvent, and they're producing this on a 1 ton per year scale, and they have been doing this for about 15 years now. So to give an idea of what we do when we get a project, like similar to what we did with Firmenich, we do what is called a catalyst screening. So for example, if there's a desire to make this product, it's called woody acetate. It's the 6,4-T-butyl cyclohexanol, which is then converted to the acetate. The cis product is more valuable. Now, the transformation involves converting the ketone to the alcohol, and you'd prefer to have more of the cis than the trans. Now, a typical screening process would set up a standard conditions, for example, say a 1,000 to 1 substrate to catalyst ratio, and we'll look at different catalysts. So if you notice, these are all aminophosphine catalysts, but they're all different. You have the bis-aminophosphine, you have the cymene aminophosphine salts, and so we just do a screening, and we, remember, what we're really looking for is more cis than trans. And here, we have one that's give us 96. This is the bomb. I didn't do too well. But then once we have that success with the hit, then we do the scale up. So we go from a substrate to catalyst ratio of 1,000 to 1 all the way up to 1,000,000 to 1. And if you look at what happened here, you still retain that cis to trans ratio. So something like this, the next step now would be go on to commercialization. So another area that we looked at was the Nayori catalyst. So we're very successful in the aminophosphine system. So this was in the late 90s, so 98, 99. And so the Nayori catalysts were well known. I have the bisphosphine aminophosphine, the diphosphine aminophosphine. Shannon talked about some of those today with her research. But at the time, these catalysts were known to be very effective for ketone hydrogenation. You could produce alcohols, including chiral alcohols, on just about any scale. We demonstrated they could be used for amines, so we were the first to be able to demonstrate that these could also be used to make chiral amines, especially for pharmaceutical application. Use hydrogen gas. The active species were not isolated, and hence the nature of the true catalysts were not known. And in fact, there was a lot of controversy at the time because of there were different proposals in what the mechanism could be. So as part of our what we consider a duty at the time, we want to see what these active species are, because by now we're working on bis-aminophosphines, aminophosphine, diphosphine, and of course now the Nayori system, the diphosphine diamine. And we're able to show that all of them have the active species as dihydride compounds. Some of those are cis dihydride, but in this case, this is a trans dihydride compound. Now, we are able to show that this molecule actually have an electrostatic interaction between the hydride and the proton. So the same concept we had outlined at the very beginning, we're able to crystallize this compound and show that it is indeed real. Not only is it real from an electrostatic perspective, being in proximity, it was also real in terms of reactivity. So this solid will spontaneously lose hydrogen in the solid state, or if you put it on the inert gas like argon or nitrogen or on the vacuum, you could spontaneously lose hydrogen from this compound. And of course, you could put a solid. Now, you go from a yellow solid dihydride to a purple amide compound, and you put that purple amide compound solid on the hydrogen, and you get back your dihydride. So it's a clear indication that this system was very active, both in the solid state and in solution. Now, what would happen is that if you now put some ketone or imine in contact with that dihydride, you essentially get stoichiometric reduction. You get the alcohol amine product, and you also get that purple amide compound, all right? Just a 1-to-1 ratio, neat or in solution. And if you put that amide compound on the hydrogen gas, you regenerate your catalyst. So we proposed this mechanism in 2001, and there have been several papers subsequently that essentially attest to this mechanism. So this was very, good for us. The amida compound, we were not able to isolate it, and well, we're not able to get a crystal structure of it for the BINAP compound, the diphosphine compound, but we're able to do that for the triphenylphosphine compound. And so this is a well-defined crystal structure for an amida compound. Or we make the dihydride, you put it on the vacuum, you remove hydrogen, you get an amida, which you put back under hydrogen, you can regenerate the dihydride. So this is a clear indication that this system, this interaction, this hydrogen bond that we started studying was not just simply a real electrostatic bond, it also has its reactivity properties. So after my stint at the University of Toronto, I was at Wilfrid Laurier University, where we developed some new ligands, aminodiphosphine system. I discussed some of that work yesterday. But in 2004, I decided to set up a company. The name of the company was Kanata Chemical Technologies. And the objective then was to essentially commercialize the technologies I've developed. By now, I have the rights of ownership of the technology. So with fragrance, with Firmenich, we reached an agreement where they have the right of use for fragrance and flavors. I have the right for everything else, including pharmaceutical application. Wilfrid Laurier University, I was able to get all the rights for that technology. So we started up this company. The focus would be to develop and apply these catalysts for pharmaceutical, fragrance, flavor, and agrochemical, and even energy applications. However, the focus was on pharma. And why? The main reason is that the pharma is the most profitable of all the chemical industries. Not only that, the global pharma industry in 2004, when I set up this company, was approaching $1 trillion globally, both branded and generic. So, we just want a tiny percentage of this. 0.01 would be fine. Now, at the time, however, it turns out that there was really limited use of catalyst technologies in pharma. There was a lot of use of palladium and heterogeneous metals, but there was very limited applications of homogeneous catalysts. So at the time, the market, however, was dominated by the branded companies. However, the generic pharmaceutical companies were now emerging, and this was a very important time to actually get into this business, because there was a lot of branded companies and pharmaceutical products which are now approaching what is called a patent cliff. So there were blockbusters like Zocor, there was Lipitor, and so on. They were going to lose patent protection. These products were selling tens of billions of dollars per year. So you could just imagine the crisis the big pharma companies were in. So they have a crisis, we see an opportunity, and so we jump in, and of course we want to to play both sides of this coin. We want to help the branded pharmaceutical companies, and of course we also want to help the generic pharmaceutical companies. So we developed two value proposition. So proposition for the branded companies that, listen, our catalyst can ensure that you have more efficient manufacturing. We have chiral catalysts, so you can make chiral precursors, chiral intermediates, even your chiral API. This is green chemistry, so there are incentives and tax credits. So for example, in Ontario, by using a chiral technology or any green technology, you will now have access to incentives and even certain tax credits. You'll now be able to limit use on even certain types of solvents. You can recover your precious metal waste. In fact, companies like Johnson Matthey and Umicore will actually buy your waste from you. So, very good value proposition. And more important, we make sure we drive this point home. The catalyst technology now will help to limit and delay the generic competition after the patent expires. And we have a value proposition for the generic companies as well. You get high quality products at low cost. This is the most important thing for a generic company. That's all they want to see. If you can't do this, they don't care about anything else. The catalyst technology, it accelerates the product development and regulatory filings, especially what is called the ANDA filings, the abbreviated new drug applications. So for a pharmaceutical company, they have to get their approval, FDA approval. Now for a generic company who is going to put this product on the market, you don't have to do the clinical trials all over. You can use the regulatory information from the branded product and just demonstrate that your product have the same purity, same quality, and even the same biosimilarity. And so you, in the study, you file what is called an abbreviated new drug application to put your generic product on the market. Now, if you're the first company to get your ANDA approved, then you also have 180 days exclusivity in the US. That's 6 months. Now, what this means is that within that 6-month period, you can collect all the profit. More, in fact, you'll collect more profit of that drug than you'll collect for the rest of the life of your product. So this 180 exclusivity means a lot for a generic pharmaceutical company. And of course, it ensures that you secure your market share. So generic companies, they're not trying to capture all the world. They know what market share they're going after in Canada, in the US, in Brazil. So you want to say, listen, we'll help you to just get your market share. If you get some more, that's a bonus. And of course, the most important point for us, we drive home the fact that you can now drive the branded company out of the market and keep your competitors off the base. So, as I said, for our value proposition, we try to play both sides. So, at the time, we have technologies. We have the aminophosphine technology. Like, for example, we have the aminophosphine PN system. We have aminodiphosphine. We have the tetradentate diaminodiphosphine system. Some of the ligands are shown here. We have chiral aminophosphines and even aminodiphosphines as well. And you can bind them to different metals, ruthenium, rhodium, iridium. So it depends on what activity, selectivity you desire. You can make your catalyst. We also wanted some diphosphine, but this was, we really want to get down to make some money. So rather than going and reinvent the wheel, we actually approached DuPont and licensed their diphosphine technology, which is called the phospholanes. So they have Diphos, BPE, ferrocene. The procedures in DuPont's patent for these were lousy, but they licensed to us at anyway, and we have to pay them every year. And they said, listen, good luck, go and figure out how to make it and sell it, which we did. In fact, our process for these phospholanes was so good that all the distributors switched to, like, for example, Sigma Aldrich, Fisher, Strem Chemicals, actually switched from Chiratech that used to supply these phospholanes and actually buy from us, all right? The key for us to make these products was actually water. When we make these products, they actually, the final step, you get the salt, which is potassium, sulfate, actually comes out of solution as a gelatinous material. Everybody else tried to filter it. We just pour water into it and wash away the salt and then distill our product or crystallize it. So we're able to get, jump on that. And we kept that a secret. In fact, this is the very first time I'm actually revealing that. And that's how we kept everybody else at bay. Now, based on the reaction you intend, what you want to do with these catalysts, you could use rhodium, ruthenium, palladium, even copper for amination, hydrogenation, as the case may be. So we also have now this valuable class of phospholane ligands. So, okay, we're now ready to go to the pharmaceutical company and make the pitch. And of course, if we're talking to a branded or a generic company, we have to remember and stick to the script of our value proposition. So we approach Apotex. Now, Apotex was and still is Canada's largest generic pharmaceutical company. They do a lot of R&D across Canada and other countries. However, we found that they're limited to catalyst technologies, especially homogeneous catalysts. It's almost non-existent. It's unbelievable. Now, we made a very good pitch to Apotex, and they told us, well, they don't do business with companies less than 5 years old. So we tell them about all the time, all the stuff we have done, all the publications, the patents, Firmenich. They said, come back after 5 or 6 years. And so that was really a wake-up call, all right? So, well, we decided to approach the branded companies. But at the same time, well, we want to see what was really happening in the branded world. And so at this time, there was a lot of activity going on. There was Pfizer, which was the largest pharmaceutical company in the world, was developing this product called Lyrica. It was approved for neuropathic pain. It's the first medicine approved by the FDA for fibromyalgia. And so this product was expected to be launched shortly. So there are a lot of companies, a lot of contract research organization was actively developing the process. It was a highly anticipated blockbuster. In other words, whichever company was able to solve Pfizer's problem to manufacture this product, it would be like winning the lottery. All right, we wanted to jump in, but before we could, Chiratech, that's basically a spin-off from the University of Cambridge, which now was Dow Pharma. So Dow was now jumping into the pharma business because of the value. Dow at the time was the world's second largest chemical company. So Dow Pharma came up with a new technology. They actually received a contract from Pfizer for the development of a catalytic process for Lyrica, and they successfully developed this technology. It was based on a phospholane technology. So at the time, there were only 3 companies with a license from DuPont. It was Kanata Chemical Technologies, Chiratech, and Strem Chemicals. Only two companies were producing the phosphorylene ligand, and it was Kanata Chemical Technologies and Kyratech. And Kyratech, literally, in the eyes of everyone, they won the lottery. They were able to develop a very efficient process to make Lyrica using a rhodium diphos, methyl diphos catalyst. Now, they offered their technology to Pfizer, and Pfizer rejected. They said it's too expensive. And so what Pfizer did, they developed their own technology for Lyrica. It's based on the ligand that was developed at Pfizer, and it's called tri-chicken foot phos. So essentially, Pfizer was able to show that tri-chicken foot phos was superior to Kyratech's phosphorylene technology, all right? And in fact, Lyrica was launched in 2005 using tri-chicken foot phos. So this is the structure of the rhodium tri-chicken foot phos catalyst. I have no idea why they call it that. Now, and true to fact, I mean, the sales exceeded $1 billion by 2006. So in less than 1 year, sales of Lyrica was more than $1 billion. It's now more than $5 billion per year. Now, why I'm referring to this in relation to us even trying to approach the branded company, because this is a lesson for all of us. Now, remember who is behind Kyratech. It was Dow, the world's second largest company. Their sales was on par with Pfizer. So this would be like a match made in heaven, two big boys dominating the pharma industry. But think about it, when a product is a blockbuster, that is $1 billion of sales or more per year, it means it's millions of dollars per day. The big pharma company, they're not going to play ball with their technology. They cannot afford to lose 1 day of production. They prefer to control it themselves, even if they have to use tri-chicken foot phos, all right? And so, you know what? This was a lesson, and we Dow got the beating, but we got the lesson. So we decided, we're going to take Apotek's advice, and we're going to wait. So we decided, okay, you know what, we're going to be another couple of years before we can go back to these generic companies and make our case. But in the meanwhile, we develop our, library of ligands and catalysts. We start selling them through distributors. We also evaluate the technologies to make a variety of chiral products, mostly products which are going to be used either as precursors or end products for pharmaceutical applications. And the focus was on the pending generic blockbusters, so products in sales with excess of $1 billion. I don't think we look at anything under $5 billion in sales. The more the merrier. We just want a tiny percentage. One such product was Lipitor. So this was slated to become generic in 2010, 2011 in Canada and Europe, 2011 USA. Now this is a top-selling pharmaceutical product of all times. $14 billion in sales in 2008. All right, so we want a piece of this. Everybody, the brand, the nickname for this product at the conferences and the trade shows was Turbostatin. Everybody wants a piece of Turbostatin, and this is a key step in making Lipitor. You need to make this chiral alcohol from this ketone. Now, the process we developed uses this catalyst. It's called a PFOS catalyst. It's actually a Johnson Matthey product. We screen everything. So when we're looking at a screening, when we're looking for effective technology, we look at our own, we also look at those of our competitors, we look at others which are just available for free. The reason is that we want to go to our client with the best technology. If it happens to be with another company, then we said, what, it's better to partner with them or to license from them rather than going with an inferior technology to the client. We want to provide the best bang for the buck. And of course, we want to get the contract, even if it means you have to share it with somebody. So this technology, this catalyst was very effective. We could make the chiral alcohol very high. I think it was like 98% yield and about 97% EEs. It was very good. The problem with this compound is that because of these pyridyl rings, it also facilitates some dehydrochlorination. So you end up with this chiral epoxide. This is a byproduct. And unfortunately, we're not going anywhere if this was in our product stream. So the companies we're talking to, for example, Pfizer, Merck, Arch Pharma Labs, companies that were developing technologies that could actually provide a solution for Pfizer, they make it very clear that there have to be none of this byproduct in it. So this was a setback for us. So what we did, we developed the PFOS system, but without those pyridine rings. And so when we developed those products, we realized that they were brand new. They've never been made before. And we give them a new name, Garphos. All right, so because of that setback, we were able to develop a brand new class of ligands and catalysts. And then we went back. So, we not only made the phenyl compound, we also make the tol, the xyl, the BTFM, DMM, and even this bulky DTBM Garphos. All right, so this was now a new proprietary technology that came out of this setback with that PFAS ligand. So we went back to the drawing board again. We take a look at this chiral alcohol, and now we could make it without any side product. So this was very effective. So this was successful, and as you can see, this was successful using this new pH Garphos catalyst. We also take a look at another blockbuster, Montelukast. So sodium Montelukast is the active ingredient in Singulair, which is used. It's an oral treatment for asthma, and it's a Merck product. It became generic in 2012. So this was another blockbuster that everyone believed that there was some opportunity. The reason why is that the key ingredient is this chiral alcohol. The problem is that there wasn't a lot of good methods of making it. Now, the process which was current at the time, they use a chiral stoichiometric borane reagent. It was not very effective, but it worked. It was slow, the selectivity was moderate. You only get 95% EE, that is chiral selectivity, but a few recrystallization and you could get the product. So in a situation like this, the pharma company will go with what works. Now, Merck also had its own biocatalytic process, but it was expensive. They had to use a substrate to enzyme ratio of 25:1, weight for weight. So it worked very well, but it was not very good. It was slightly better than the borane reagent. Now, this is the alternative product technology we developed. So we developed this catalyst. So it is now one of our xyl Garphos with a chiral diamine dipen, and it was cationic. We make it cationic because the reaction takes place in a mixture of water and I think THF or water and alcohol. So we want to make sure that it was soluble in water. So we make it a cationic catalyst, and it worked very well. You're looking at a substrate to catalyst ratio of 2,000:1. Our crude product was 99% purity and 99% EE. It's far superior than both the Merck product as well as the stoichiometric reagent. How good it was, now we have a branded company at the table with us. All right, so Merck was talking to us about this technology. So is Teva, that is the world's largest generic company at the time, and Tianyu, which is just a Chinese manufacturer. Now, we eventually reached a deal with Teva where we could actually send them our catalyst, and they now were testing it in their manufacturing facility. The problem is that once you activate the catalyst, you get a very reactive and air-sensitive dihydride compound. And unfortunately, Teva was not able to sort out, was not able to handle it. So after about 10 tries, they gave up. And so we had to work out an alternative means for them to get this technology. I won't go into that details, but what I want to point out was that, you could have a very good technology. You could get it to your client, and they may not be able to use it because they may not have the skills, they may not have the equipment, and they're not going to waste their time trying to figure it out. So this was also a lesson to us that we actually take note of for any future interactions where we need to make sure that we have a stable catalyst. Now in 2010, we finally got a seat at the table with Apotex. So our 5 years was up. Now they were willing to talk to us, and they liked what we had to offer. Now the problem is that they had some regulatory filings, some regulatory issues with the U.S. The products was now banned from going into the U.S. until they fixed that. They were only able to do that 2 years later. So we had to wait another 2 years. But by 2012, Apotex was now ready to talk to us. And in fact, they were in a desperate situation. They were working on this process. It's a catalytic process to make sitagliptin, which is the active ingredient in Januvia. It's a Merck product, and it's to treat type 2 diabetes. Now, they were working on this for 5 years with no success. They want to have a drug master file by 2013. They want to do some commercial production by 2015. So even though this product is going to be generic in 2020 in Canada and 2022 in the US, this is how far back these companies are working on the process. All right, so that's something also to bear in mind. So we got the discussion going with Apotex. We signed a contract in September 2012, and by November 2012, we complete the process, and we gave them a technology transfer package. All right. the crude product was greater than 99.9 chemical and chiral purity. Now, what is interesting here, while these guys were struggling with the technology, they were not willing to talk to us. We fixed it in 3 months, all right? And so the development work was completed in Brantford, and it's now slated for production in Mexico. They're looking to produce 60 tons per year. And this product sells for $2,000 per kilogram. So it's a very valuable product for Apotex. Now, just as we finished the Apotex project, which was November 2012, we were approached by Teva in December 2012. So in Jamaica, we have a saying that when it rains, it pours. So here's another opportunity. Now, Teva already had a process, but they don't believe it was good enough because other companies now want to develop catalytic process because the originator company, Merck, had a catalytic process. And Teva want to make sure that when they go to market, they have a very good process. So they came to us. We also had some discussions. We started working on the project, and we finished this in April 2013. Same thing, 99.9% chemical and chiral purity. The development work actually started in Petah Tikva, Israel, and their target, they are bigger than Apotex, is 120 tons per year. But I want to draw your attention to the catalyst. This catalyst we developed specifically for Teva because we don't know which group they're going to give it to. The last time we sent them a catalyst, they lost all of it because they couldn't handle it. Once they activated it, it was dead and with no product. So we make sure that this catalyst, which was designed to be robust. How robust this is shelf stable and air stable. And when we're setting up the reaction, we open up the pressure reactor, take the cover off, then we pour in the catalyst, we pour in the additive, we pour in the substrate, we even pour in the solvent, and then we close it up. Then we degas it, pressurize it with hydrogen, set up the temperature, and we get 99.9% chemical and chiral purity. So this was a very good lesson we learned before, and we actually, bring it to bear the second time around. We also, so by January 2013, did I say when it rains, it pours? We are now in discussion with Cambrex. They actually was by August of 2013. They have to take this process to market. There are two products here, hydromorphone, hydrocodone, that they have to produce. It's a catalytic isomerization process. These are the ligand and the catalyst precursor they have to use. The problem is that they were not able to make the ligand and the catalyst on any scale, all right? Now, so they came to us, and I won't go in all the details here, but suffice it to say we're able to develop a process to make these, both the ligand and the catalyst. And so by about May 2013, we have a contract with Cambrex for supplying both the ligand and the catalyst precursor for them to make hydrocodone and hydromorphone. So this was our standing in 2013. We have commercial supply contracts for ligands and catalysts, for distributors, for pharmaceutical companies. Several other contracts are in the near street. We're now looking at revenues of about $25 million US per year. But at the same time, we were now seen as a takeover target. In fact, we had discussions with Apotex for a merger and acquisition, same thing with Johnson Matthey. But eventually the company was bought by one of our existing investors. And unfortunately for him and for all of us, he lost all the contracts before the end of the year. So this happened in August 2013, and by September 2013, we started up a new company. So we went back to what we're doing. Now we're still developing catalysts, for pharmaceutical, and the focus now, and it's the name of the company, the focus was on pharmaceutical applications, and we also want to extend this to stable isotope products, in other words, deuterium products for pharmaceutical application. Now, here I want to now introduce deuterium, and well, why deuterium in pharmaceutical applications? Now, we all know deuterium as heavy hydrogen. It's a stable isotope. The other thing, which is important, is that deuterium is a high-value product. For those of you who have to use deuterated solvents every day, the value of those products is because of the deuterium. So deuterium, D2 gas, actually costs between $1,500 to $2,000 per kilogram. So anything that contains deuterium is considered a high-value product. Now, right now, deuterated pharmaceuticals are being developed as some of the next-generation products. So we went through the phase of those blockbusters and the mega blockbusters. Now there's a phase of of branded deuterated pharmaceutical products coming on the market. It has been shown that these deuterated products, depending on their, and where in the molecule the deuterium is, it actually improves effectiveness, safety, and tolerability. All right. Now, so since 2015, we have been working on developing homogeneous catalysts that are effective for deuteration using either deuterium gas or D2O, that is heavy water, to deuterate a variety of chemical products. Now, the catalysts we developed, they're air-stable, shelf-stable, and so it's also part of the lesson we learned in our previous life that want to facilitate safety, handling, storage, and ensure that they are commercialized. So we don't want to be in a situation where the client mishandles it and then we lose an opportunity because it's too sensitive. And so this is an example of some of the deuteration work we do. So like, for example, diethylene glycol, we can use our catalyst and just deuterium gas, and we can actually fully deuterate it, all right? So we can go from, so the reaction is very mild, 140 degrees centigrade, 10 atmosphere deuterium pressure. We can use a neat substrate and get neat product. We can filter by filtering through silica gel or by distillation. Now, these deuterated diethylene glycol can be transformed into a variety of product. The other thing we can do with these catalysts is selective deuteration. So, for example, the same diethylene glycol, we can actually deuterate the terminal CH bonds, leave the internal intact. With other catalysts, we can actually deuterate the internal and keep the terminal intact. All right, so this is an example of, depending on what the client needs, we can bring that to bear. And in this case, even for these selective deuteration, we're still looking at neat substrate going to neat products and purification by filtration or distillation. Now, what you can do with these deuterated diethylene glycols, you can make a variety of products. For example, you can convert to deuterated morpholine, N-methyl morpholine, or even dioxane. And you can do the same even with the partially deuterated. So imagine that you can now make morpholine, which is now selectively deuterated depending on what the application is. So this is, so the good thing about this is that with the demand for deuterium products coming on the market, we have the technology that we can make a variety of these products. We can do arenes, we can do alkanes, we can do, compounds like these. So, it put us in a very good standing where deuterium is concerned. Now, in April 2017, so just over a year and a half ago, the first deuterated pharmaceutical product was approved, all right? So this product is called deutetrabenazine. It's a Teva product. It's actually derived from tetrabenazine, which has been around from the 1950s. So it's as generic could be. But by just simply sticking some deuterium on it, and of course all the clinical trials were done, the approvals are now in place, this is now projected to become a blockbuster. All right? Now, it is the first deuterium pharmaceutical product to be approved, but what's even important, there's several other products incorporating deuterium which are being developed. And what was important here is that the deuterium is actually derived from deuterated methanol. Okay? Now, it turns out that there's now a lot of quest for the production of deuterated methanol. The existing process to make deuterated methanol has been around from the 1950s and 1960s. Essentially, it's carbon monoxide gas with a heterogeneous catalyst and deuterium gas. Only 2 companies actually produce deuterated methanol. So we actually have an uphill battle when we said, okay, you know what, we're going to see if our catalyst can do the trick. And so, yes, we actually develop a process, I cannot disclose what this is, but it's a carbon dioxide derivative. With deuterium gas or catalyst, we actually make deuterated methanol. And we're doing this under very mild conditions. All right, so, our substrate is here stable, the catalyst is here stable. Our reaction conditions is 80 to 120 degrees and 30 atmosphere of deuterium gas. Now, we can separate the deuterated methanol from our byproduct by just simply distillation. All right, so it's a very high boiling point difference between the methanol and our byproduct. And what we do with our byproduct, well, we convert it back to our starting material, and in the process we get another byproduct, which happens to be deuterated chloroform. Okay, so the byproduct, as I said, is converted to deuterated chloroform. We regenerate our starting material for deuterated methanol. The catalyst is here stable. Distillation process is stable. The revenue from the deuterated chloroform actually pay for the entire process. In other words, or deuterated methanol as a negative cost. And with the deuterated methanol and deuterated chloroform, so we now have commercial opportunities. We can make these on any scale. The desirable product is also deuterated methyl iodide. So we're in the process of actually making this on a commercial scale. Now, what I want to point out here is that so the first deuterated product to be approved is deutetrabenazine. It was approved in 2017. It's a treatment for chorea associated with the Huntington's disease. But there's deuterated dextromethorphan. Okay, it's in phase 3, advanced stage. This is actually expected to be approved. And then there's another compound here that's actually now phase 2. So I'm just pointing these out. There are lots of others, okay? They are at various stages of approval process. But what I want to point out more than anything else is the fact that if you look at these compounds, these are all derived from deuterated methanol or deuterated methyl iodide. So there's a lot of demand for this product. There are only 2 manufacturers, and we want to be the third. So at this stage, I just want to just kind of, just entertain what is now going on in the pharma industry. So deutetrabenazine, as I said, it was approved in 2017. It's a branded product. Now, what is happening in the pharmaceutical industry is that most branded pharmaceutical companies now have a generic division or partner. And the reason for this is that with the patent cliff, a lot of companies learned a very hard lesson. Pfizer was looking, well, they lost a lot of money, $14 billion per year, and all of that was with just one product, Lipitor. All of that was gone within about 2 to 3 years of generic. They actually were still pushing branded Lipitor, but people went for the cheaper atorvastatin generics, which was essentially the same compound. And so it's a lot of losses for them. So most branded companies now have a generic division or partner, all right? And they do this so that even after they lose their patent rights, they still can get some revenue from that product and piggybacking on the brand that they build up over the years. Now, Teva is the world's largest generic pharmaceutical company. In 2015, Teva purchased Aspect Pharmaceutical for $3.5 billion. Aspect was a company that developed deutetrabenazine. So they bought Aspect. They not only get deutetrabenazine, but they have the entire portfolio of deuterated products that Aspect was developing. Now, as I said, deutetrabenazine was approved in 2017. It's a Teva branded product. The brand name is Austedo. This product will become generic in 2024. All right. Now, several other generic developments are actually on the way for this product. So even though it's, it has been on the market for a year and a half, companies are already developing their means of actually getting access to the generic product. In fact, companies have actually a process. They want deuterated methanol or methyl iodide, as well as other deuterated products, because there are lots of other products that use other deuterated compounds. So at this stage, I just want to summarize that we are able to do what we did because of our capabilities in catalysis, especially in relation to pharmaceutical and fine chemical manufacturing. Our catalysts and processes, they're cost-effective, efficient, they're environmentally friendly, and these catalyst technologies allow us to be competitive supplier of pharmaceutical products, fine chemical products, and now more recently, stable isotope products. And the market is global, all right? So we're a local Canadian company, but we supply products to companies all over the world. One thing I should point out, with Kanata Chemical Technologies, we supplied over 300 products through the Strem Chemicals and Sigma Aldrich. We still supply most of those products even through Kamal Pharmachem, and so this is something which will be ongoing as well. So in addition to the pharmaceutical side of things, we also distribute these products. So here I want to acknowledge the folks who have contributed to this work. So these are the employees at both over the past 14 years at Kanata Chemical Technologies and now with Kamal Pharmachem. They have contributed in a variety of ways and capacities. In fact, all except one, a chemist, So they have all, so pretty much, there have been significant contribution. And I also want to acknowledge and really thank the UWI Monarch Catalyst Research Group. The group is headed by Professor Das Gupta, Professor Paul Maraj, and individuals in this group have actually, their focus is on some of the fundamental chemistry that I'm discussing here today, and work is ongoing. And so, it may just look, some of this work may just be taken for granted, but I just want to point out that I actually started looking at hydrogen bonding. All right, so I want to thank you for your attention.
Thank you very much. That was most enjoyable. I have a number of questions, but I will allow a few which I will probably ask you later. But this is question time. Can we have, are there any questions from the audience?
I have a question about your deuteration studies.
Yep.
For that mode of action.
Yeah.
So, you did mention about partial deuteration.
Yeah.
Is it just a simple modification of the reaction conditions? Because, or is it, perhaps, I suppose you can divulge something. With catalyst,
Yeah.
is it that you can get the complete deuteration with that same catalyst system by simply modifying the reaction conditions, or do you modify the catalyst to get the partial versus the complete deuteration that you
You can do both. Yes. So you can use the same catalyst, but by modifying the conditions, you can get internal and terminal deuteration.
These are ruthenium and iridium-based systems.
Yes, they are ruthenium and iridium-based systems. Next question.
Have you ever considered fluorination? Because many pharmaceuticals
Yeah.
incorporate fluorine, and fluorination is hard.
Yeah. So, that's a very good question. In fact, there is a company called Fluorinov. And if you look at it, the founder was Malik Slassi. We were actually in the same building, the Mars Center in Toronto. His specialization was to put fluorine at different points, just the same way they're now putting deuterium in these pharmaceutical products. So most of these products will be approved because they're existing products which the clinical trials have already been done. So essentially, once they put in the deuterium, it's not the same as putting a generic product on the market, but they don't have to go through all the gory clinical trials as putting a product on the market for the first time. So they have to be safety, they have to be efficacy, and other regulatory filings. Now, what Malik did was pretty much the same thing. He developed these compounds, and he essentially put fluorine at selected positions and looked at the activity and selectivity. And the fluorine actually impact significant properties, like, for example, tolerability, reduces isomerization, and so on. And one of the most significant compound he developed, it was shown to be more effective, far more effective than the parent compound for cancer treatment. In fact, his company was bought for $35 million. He got $10 million up front. And at the time, it was just a company of 2 people.
I was thinking, catalytically, is it possible to introduce fluorine using your catalyst?
It may be possible, but I've not looked at that yet.
That's what I
Yeah.
Any other questions? Or are you blown away?
Yes. Thank you. Yes. Mike. So I can do it. Yes.
So I was wondering what property of the ruthenium that results in such, wonderful behavior, for it to be called a bomb, what is it about this metal that results in such, wonderful behavior?
It's a hydrogen bond.
The
The hydrogen bond. So you get so you get the what is called the bifunctional activity, because you have if you notice, most of these catalysts have a diamine or a NH group on it, and that NH group will actually interact with the hydride once it's generated. Now, it's not in all cases. Like, for example, the catalyst for carbon-carbon double bonds, none of those really have the bifunctionality. But for most of the ketones, the imines, those have that bifunctionality, and that's what matters. In fact, even the iridium system work as well because of that bifunctionality.
That's interesting. I also had a question about the hydrogen bond.
Yes.
Bond.
Yes.
What is the distance that defines them, and the limits?
Yeah. So the van der Waal distance, if it's structural as opposed to electrostatic interaction, is 2.4. That's sort of used as the guideline. Some of these interactions is down to like 1.8, 2.2. So, for example, the ruthenium dihydride that I said spontaneously lose hydrogen, the X-ray distance between the hydride and the proton is 2.2 angstrom, and it's actually spontaneously losing hydrogen.
That's interesting. So, did you think to use them as sensors for hydrogen in your cars? Did you have that color change?
No, we haven't, but we have actually used similar technology for chemical hydrogen storage. And we have a technology which is actually being commercialized as we speak in the UK where we use ammonia borane as our hydrogen storage material, and we can essentially liberate quantitative amounts of hydrogen from the material.
Okay, thank you.
Yeah. Yes.
No, I'll speak for that. Just wondering, what would you say would be the greatest limitation to, for example, this catalytic system that does these catalytic systems that exhibit that non-classical hydrogen bonding?
What do you mean greatest limitation?
In terms of their activity, I'm sure their inherent properties will impact on ultimately what the reaction outcomes are. But in terms of their ability to withstand, elevated temperatures, I don't know if their solubilities are issues, do they exhibit any limitations from what you have observed?
And that's a very good question. There are limitations depending on the application. So most of the ruthenium catalysts that I've outlined here, they are ruthenium. Once you activate, they are ruthenium 2 to start with. Once they're activated, they're still ruthenium 2. So essentially, I've just exchanged chloride for hydride. Other compounds are ruthenium 4, but once they're exposed to air, you get ruthenium 3, and that's the end of it. And there's nothing you can do. You cannot resuscitate it. On the other hand, for the iridium system, the stable oxidation state for this system is iridium 3. So you'll get even trihydrides. Now, the chloride containing iridium compounds are even more stable than the ruthenium. Some of those catalysts we even could heat up to 120 degrees for 30 days in air, and they're still stable. However, when the iridium system is activated, you get iridium trihydride. So essentially exchange the the chloride for hydrogen. And they're also air sensitive. They oxidize, you'll go from iridium 3 to iridium 5. However, those have a different attribute than the ruthenium system. If you put those in a reducing medium, then they go right back to iridium 3, and they're ready to do their thing again. So the ruthenium, as I said, the limitation is that they will go to ruthenium 3, and that's the end. The iridium can go to 5, you can bring it back down to 3. All right, and so that's just in relation to that's a limitation in terms of the oxidation states. In terms of activity, we usually do screening because sometimes the interest is not turnover, it may be selectivity. And so it's just a matter of what the desired outcome is. So, you set up your screening accordingly, and you'll choose a product depending on what the what the desired outcome is. And just one more thing I want to mention. There was a product from Firmenich that they didn't want cis, they didn't want a trans product, they want a 60 to 40 mixture of cis and trans. I've never seen anything like that, but that's what the client want, and that's what they got.
Other questions? Have you explored this scope and the limitations of this deuteration? Because I see an OCC motive in your substrates. Is it
Which one?
in this deuteration? No, the diethylene glycol deuteration.
Yes.
Have you?
They said the O.
No, the slide that you had up before. Yes, that one. Have you explored the scope or the limitations of that process beyond?
Well, what we have done both. We have done the full deuteration, the selective deuteration, and we have made the subsequent products.
Right. Beyond the diethylene glycol as the substrate.
Like other substrates, we have looked at ethanol, we have looked at, right now, we have even looked at sodium borodeutheride. So we can make, we can use sodium borohydride and convert it to sodium borodeutheride using a catalyst and deuterium gas. So we can do even a salt.
Yeah, I'm interested in the mechanism.
Yes, we're actually making that product as we speak.
Are there any other questions, ladies and gentlemen? If not, we are going to ask our cast member to present Kamal with a token of appreciation for his
Thank you very much for your
participation. and
wonderful
his,
presentation. I'm Dr. Bagara.
most,
Thank you.
Delightful lecture.
This is a small token of appreciation on behalf of CAS.
Thank you very much.
Thank you.
Appreciate it. Thank you.